enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show, the orthopedic and sports medicine edition of the show this evening. We're lucky to have a doctor here in the studio, right from Boca Raton, who actually practices here in Boca Raton. And doctor, correct me if I'm wrong, but it's Dr. George Botelho.
Correct.
I got
Very
the
good.
last name right.
You bet.
Sometimes it doesn't have my last name either. DePino, I've heard all kinds of different ways of saying DePino. But Dr. Botelho, tell us a little bit about yourself. So you have an office right here in Boca Raton, right around the corner off Glades Road.
I do. My office is on the corner of Glades Road and Lyons, slightly west Boca. Actually, it's 9033 Glades Road, second floor, Suite D.
Okay. Mm-hmm. Right around the corner from here, very convenient. Very happening area, Glades and Lyons Road. Lots changed there in the last few years.
Yeah,
definitely.
The traffic patterns.
Yeah, definitely. I actually drive that way every day, so I actually pass you now. I know where you're at. So you're an orthopedic surgeon, and also that doesn't sports medicine kind of go along with that as well?
Well, orthopedic surgery has so much within its boundaries. Sports medicine is clearly one of them. Yeah, we do sports medicine, generally speaking, as orthopedic surgeons. So definitely part of what we do.
Sports medicine, I'm always asking orthopedic surgeons when I do get them on the program a little bit about it, because it's more of the management treatment option. Like sports medicine would be more of like a way of managing, maybe sometimes without surgery, if that's maybe one of the options.
It is actually a massive option. A lot of people think of orthopedic surgery as surgery. But the majority of what we do as orthopedic surgeons is management treatment. It's preventative as well. In all surgical specialties, especially in orthopedic surgery, probably better than 75% of the patients are non-surgical.
Oh,
so quite a large number.
That's good to know.
Yeah, quite a high number.
Some injuries can be managed without surgery.
Quite a few.
Yeah, more 3/4.
Quite a few. In fact, we will sometimes talk about spine and herniated disc, and everybody is so afraid of the term herniated disc. It's quite interesting. Of all herniated discs, only 2% of all herniated discs really require surgery. So a very small percentage.
That is, I didn't realize that.
Very small percentage, yep.
Yeah, because the first thing you think of herniated disc is I'm probably going to have back surgery.
Not
the general public, I'm saying.
Yep, not necessarily.
Yeah.
Yep.
Well, we're releasing the stigma here today on the How to Stay Healthy show.
Yep.
So we're really glad to have you, and I want to talk to you also a little bit about, so orthopedic surgeons, they can treat pretty much almost from head to toe, right?
They sure can. As a matter of fact, in my practice, I, for all intents and purposes, treat from the upper neck all the way down to the toes.
Okay.
Yep.
And you super specialize in the spine.
I would say nearly half of my practice is dedicated to shoulder and spine.
Okay.
So of the majority of my practice is just those two areas, spine and shoulder alone.
Okay.
So
I'm going to give Dr. Botelho's website out a few times, injuryspineinstitute.com. There's a ton of info there.
Yep.
As I got a ton of info there as well for my questions. So great website.
Thank you.
Easily navigable.
Yep.
If that sounds right. Yeah.
Navigable. That's correct. That's correct.
I got it right.
Or we both got it wrong.
Yeah. They'll let us know, because we're always live on Facebook with the show. That's a big component of the show nowadays, social media. And we're always on allcountyhealthcare.com's Facebook page and their website. So if anyone wants to go back on the show, maybe you missed something and you want to get back to that point where Dr. Botelho was explaining a certain ailment or treatment for, orthopedic conditions, you can go there, allcountyhealthcare.com. Now, you also provide treatments, I saw on your website, for the wrist, elbow. We talked a little bit about shoulder and the hip as well. So wrist, elbow, shoulder, hip, knee, and spine. Mm-hmm. Okay,
along
so those
with
are
ankle, foot, fracture care. The list goes on and on and on. For all intents and purposes, anything that is joint, bone, muscle, tendon, and even nerve related is pretty well encompassed in my practice. Many orthopedic surgeons practice general orthopedic surgery, but stay away from spine. I actually do both areas of orthopedics, general orthopedic surgery, as well as sports medicine, joint replacement, and spine.
okay.
So it's quite an extensive list.
It is definitely. What age range of patients do you treat? Is there a certain point you start at a certain age and then go all the way up?
I have treated all the way down to young children. Generally speaking, we like to treat patients that are about 6 years of age and older. And we treat the geriatric population, and hopefully there's no limit there. I've treated, and believe it or not, operated on a broken hip in as old a patient as 106.
106.
Yeah.
People are living longer.
God bless
aren't
them.
they?
God bless
And
them.
that's kind of to do with modern medicine. It's got, the last 2 decades, even the last few years, I know we're going to get into a little bit of, you're doing robotic surgery, but just talk a little bit about how modern medicine has changed since you got into the field.
Well, we're constantly evolving. The medicine is a field where I don't think that we'll ever be able to find what its boundaries truly are. Great example is cancer medicine and cancer care. We've not even touched the tip of the iceberg with regards to treating cancers. So we have so far to go. With regards to orthopedic surgery, we've seen, when I was in training, I remember I saw 2 shoulder arthroscopies prior to my completing the program, and I never thought that they would actually fly and become mainstream. And now it's rare for us to open up a shoulder. I can't remember the last time I opened up a shoulder. Everything could be treated through the scope just about. And that's not the way I was trained at all. I was trained a while ago, but nonetheless, it's really evolved, and it continues to evolve.
And that's the arthroscope with just a very small incision.
Small punctures. Mm-hmm. And they, generally speaking, patients have these tiny little incisions. Their recovery is a fraction of what it used to be. Patients, though, feel, and it's a major mistake that a lot of our younger patients face, and that is they have minimally invasive surgery or arthroscopic surgery, and they anticipate that they'll heal faster because they have less pain and they have smaller incisions. But we're doing major surgery through the scope, so they still take some time to heal, and oftentimes they stress things a little too soon. But fortunately, we have a fairly educated population here in Boca, and they follow the rules. It makes life a little bit easier for us as orthopedic surgeons.
Oh, that's great to hear. And that minimally invasive approach is great to hear versus open as well, because definitely things heal faster.
And it's less blood loss and less intrusiveness. And a lot of people say it's less invasive. I like to think it's less intrusive because we could be quite invasive through small incisions. We can do quite a good deal of work. We're doing spinal fusions through small little incisions now, something that was unheard of in my day when I was in training. So and now it's become mainstream for all of us.
That has a lot to do with the technology.
You bet.
Yeah,
There's so much research going on, and it continues to go on, something that's truly fascinating in the field of medicine.
And the way that doctors are able to see everything amplified on the screen versus where you just used to look with the naked eye.
Yeah, but that's where the challenge is, because when you think of a scope, and when I was actually interviewing for medical school, I was at St. Luke's Roosevelt in New York, and that was one of the questions that I was asked, and what did I think was one of the hardest surgeries that I would probably face. And they were looking for me to say arthroscopy. I was not yet a doctor. I was only in medical school, so I had no idea. And I get it, because you're looking at a screen. Your hands are on instruments that have extensions, And the tip of those extensions are extending inside the person's body. So you're not touching the person, nor are you looking at what you're doing. So it's quite challenging, especially for us older surgeons, where we didn't train with video games. Now kids train with video games, and it's so much easier. They have so much better eye-hand coordination. So it's been fun watching the entire spectrum in orthopedics evolve, where this has become mainstream.
Definitely. I even have a heart surgeon who's been on the program who actually does the surgery a few weeks before on his, if he has the time.
Incredible.
On his
simulator.
Yeah, simulator. It's a computer simulator.
Yep.
And he's actually at a conference right now in San Diego, Dr. Sarab Sanan. He's a structural heart disease specialist. And he's at one of those tech conferences. I've just been watching him on LinkedIn. Like he's like it's moving so fast, and that's great for the patient experience, because it's more minimally invasive, quicker hospital stays, quicker recovery time.
Even on that note, you mentioned quicker hospital stays. We're now becoming more mainstream with regards to doing joint replacements in an outpatient setting. So I'm doing hip replacements and knee replacements and shoulder replacements as well in an outpatient setting. So patients come in, they go home the same day, they have lower risks of infection for that reason. They're ambulating and getting up and about much faster that way.
Yeah, the ambulatory surgery center growth in the U.S. and the world
has skyrocketed,
and
it
will really
continue to do so.
That's great. Tell us some of the centers where you do surgery and what hospitals you're on staff at.
Okay, well, I'm primarily out of Lake Worth Surgery Center up here in Lake Worth. It's very, very accessible. We're able to do major stuff through there. And that's primarily where I do the vast majority of my work. I like outpatient work because patients do better. Oh. And the other thing that I like is I like stability in my practice, insofar as by working at multiple hospitals, you're on call for emergency rooms, and you're constantly being called out and interrupting your schedule and inconveniencing people. With the way I keep my schedule, we don't have to inconvenience people. We're basically an elective practice and an outpatient practice. Makes it nice and convenient.
Sounds like you have it figured out, and that's why we wanted to have you on the show to share this great information on the latest and greatest in healthcare. Now, I mentioned robotic surgery before. I got to ask you about it because everyone asked me about it. Where does it fit in the orthopedic setting? Is it something that you're training on, you're using?
It is something that we have trained on and that we do use. It does have, shall we say, limited applications in orthopedic surgery. Or robotic surgery is used in joint replacement surgery. It helps us to become more precise with regards to how and where to make our cuts. But the one mistake with robotic surgery is that it fails to take in the experience and the functionality behind it. And a great example is in robotics. Robotics play a great role in general surgery. They play a great role in heart surgery as well, where it's able to allow a lot more precision. In orthopedic surgery, as an example, a knee replacement or a hip replacement, I used to use robotics routinely, and you depended on the robot. But you also need to calculate in the ligamentous stability of a joint, and you need to create ligamentous balancing. And the computers and the robots don't do that as well as the human mind can do. And that's where the importance of the human mind comes in, and removing, shall we say, the robots so much, even though robotics is important. A great example, we've transitioned from using robotics for joint replacements to actually using computer-generated cutting blocks. And what happens in a case like that is we'll take a patient, as an example, who needs a knee replacement, and we'll do an MRI or a CAT scan of their knee. And we'll get absolutely precise measurements that way. It's not a matter of putting a ruler to anything. It's calculated via computer. Then a computer will then create those devices that you need to place over the person's joint to recreate their anatomy perfectly, thereby taking into account their ligaments and the tension that their ligaments are already under, something a robot would not be able to do. And we're able to then do a joint replacement with mixing and matching of multiple sizes. A great example is a Knee replacement probably has in excess of 200 different combinations of sizes. That way we can fit each individual. Here it tells us even before the surgery happens what size to use, what cuts to make, where to make those cuts for precise fit. And along with that, there's less operating room time, there's less blood loss. And now we've even gone so far as to have instruments that are disposable. So they're sterilely packaged. You use them once, you throw them away, and the risks of infection are so much lower as well.
That's
so
very smart.
It's just amazing. I never thought it would have gone that way. I'm a bright guy, but I wasn't that ingenious to think that that's the way we could go.
Well, that's fascinating. And it sounds like you have an engineering mind. The way you just explained that, I think orthopedic surgeons, they have to have an engineering mind as well.
You need to. Yeah, you absolutely need to, because the human body is actually the quintessential feat of engineering. It really is. There's nothing that could be engineered better than the human body. You think that a typical knee will last an individual 60 to 70 years, and the best technology we have these days is roughly 20 to 25 years. Can't beat what we were born with. Just can't outdo it.
No, you can't.
Can't outdo it.
We're here with Dr. George Botelho. We're going to take a quick commercial break. On the other side, I'm going to ask Dr. Botelho about PRP, and I know you want to hear about stem cells on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Hello, South Florida, and we're back with Dr. George Botelho. InjurySpineInstitute.com is where you can find all the information. Dr. Botelho is right here in Boca Raton. You said at the corner of Glades and Lyons?
Sure is.
Okay.
The northwest corner.
Know exactly where that is. And again, InjurySpineInstitute.com. You get all Dr. Botelho's info there. Before the break, I teased it in there. I wanted to ask you a little bit. I did my research here. Platelet-rich plasma injections, other known as PRP,
You bet.
to the common man. What are they? How can they help? And is it a pain reliever in a way for chronic pain?
PRP is actually a very good pain reliever. Many people confuse PRP and stem cells. Those are two big names now that are permeating the computers and medicine, including rejuvenating medicine and anti-aging. Now, PRP is actually derived from the patient's peripheral blood. It's a blood product. It's not a bone or marrow product.
From their own blood?
From their own blood.
Okay.
So in an individual where we use PRP, and I'll give you several examples shortly, but in a patient where we use PRP, we'll draw their blood just through an IV stick. And then the blood is prepared in such a way to take off many of the cellular factors, not all of them, but many of the cellular factors. And what you're left with is the plasma, and the plasma is rich with proteins that are very, very, very strong factors for inflammation and for healing. In fact, both platelet-rich plasma, and here's a new term for you, it's not PRP, but PPP, platelet-poor plasma. So there's actually two components, and most of the time we think of the PRP and the platelet-poor is thrown away. But the platelet-poor is a wonderful source of healing factors as well to decrease scar tissue formation and decrease postoperative infection rates.
Very important.
So, very interestingly, there's so many different components. We always think of PRP. Now, PRP is great for inflammation. It actually has a protein in it. It's called alpha-2 globulin protein, and it's one of the strongest, if not the strongest, anti-inflammatory factor in the body that's naturally occurring. So a person is able to receive some of their own blood plasma, okay, where you have almost zero reaction to whatsoever, and it has some of the strongest anti-inflammatory effects. I do PRP injections as epidurals for people's backs instead of using cortisone. Not all the time, but just the other day I had a patient who came in and I did an epidural on him and I did PRP. The gentleman had diabetes, and he came in with a blood sugar of almost 260 because he didn't take his medication.
Whoa.
And a person like that, you don't want to give him cortisone because it'll throw his blood sugars way off.
Yeah.
He received platelet-rich plasma instead, and he'll have probably superior effect than even the cortisone itself. So in a person with, I would say, early or mid-stage osteoarthritis, they do great with PRP. End-stage arthritis, there's not a heck of a lot to do for. But probably early or mid-stage arthritis, PRP does great. On the other hand, you take stem cells and you inject stem cells into a joint where it has no blood supply, normally, and you're putting stem cells in, and stem cells would not be as effective there. Although, you take that same knee and if a person has a meniscal tear, and you repair the meniscus and you put stem cells out to repair, it augments the repair and actually increases chances of healing and decreases healing time. So each of these elements has a role, and that role is so important in selecting what role it is. Many times when I do surgery on a patient, I'll include, no matter what, stem cells. I harvest the stem cells from the patient's pelvis. We spin the blood down as we would under PRP, and we take off the stem cell rich cellular elements. It's not only stem cells, there's many different elements in it. But then we add, or I add those stem cells, and it will augment the healing. Probably one of the first patients that I ever saw it on was a police officer that I treated down in the Keys. She had 2 disc herniations in her neck.
Ooh.
She needed a 2-level neck fusion. And I was able to return her to light-duty work at 6 weeks because she had almost complete healing at only 6 weeks postoperatively. And the only difference that I could ever explain was I added stem cells to her treatment. From then on, I've been using stem cells and PRP almost routinely.
Yeah, returned her back to her quality of life.
Sure did.
That can do a lot for the mind as well, the psyche. I mean, the police officers want to be working.
That's what what people want when they come to an orthopedic surgeon. They're not sick. They're kind of broken, and they want to be fixed. It's kind of black and white.
And they want to get back.
Oh.
I will mention something. All the great doctors that we've had on this show, if you look back on the interviews, I always say this. A great doctor has many tools in their toolbox. Here we started this conversation this evening about non-surgical treatments. Then you told us about the laparoscopic approach. Then robotic surgeries in your toolbox if you need it. Then you go into the PRP and the PPP and the stem cells as well. I mean, you have a lot of different tools in your toolbox. You have the experience. That's a great doctor. Check Dr. Botelho out, injuryspineinstitute.com. There's a ton of info on there, and I'm really glad that we got to talk about stem cells, PRP, and learned about, correct me if I'm wrong, platelet-poor plasma.
Correct.
PPP.
Yeah,
Never
correct.
heard that term. Been
Yep.
doing this show 3 years.
Yep. Amazing stuff.
Thank you. That we're always learning something. I wanted to ask you also, you mentioned St. Luke's before. Where take us through your education and training, if you would.
Well, I'm a Jersey boy, born and raised in New Jersey. I left New Jersey in 1993 to come down here to Florida to practice orthopedic surgery. Prior to that, I studied at the Johns Hopkins University and received my undergraduate degree in chemistry. Following that, I went on to the Rutgers Medical School, and I completed 4 years there. And following that, I went on to Rutgers and Newark, specifically for the University of Medicine and Dentistry, where I then went on to do my orthopedic residency training. Following that, I came down to Florida. Then ultimately, I became board certified. And I've now been in Florida doing this stuff for about 25 years already.
Well, we're glad to have you.
Thank you.
As well. Dr. Botelho said his office on the corner of Glades and Lyons. He said the northwest corner. I'm a good listener today.
Right above the PNC Bank.
Oh, I know exactly where that is.
We're getting closer
I
and
drive
closer
by there
each
every
time.
day.
Yep.
That's the landmark right there.
You bet.
InjurySpineInstitute.com. We got about a minute and a half, so I don't want to rush you, but we got to start wrapping up here. What brought you to South Florida?
The weather.
The weather? Yeah.
Simple. I came from New Jersey.
Yeah.
I was always cold in the wintertime. I just didn't want to do that anymore.
You like
Plus,
my-
I love to fish.
Yeah.
And I knew that ultimately I would find my wife here.
Okay, great.
Just didn't know that yet, but ultimately
Are you
that's
still
what
fishing
happened.
today when you get some time?
When I have time, I sure do.
Inside or out intercoastal or out in the ocean?
Ocean.
Okay.
Ocean.
I like that. We got a minute. A lot of people know I'm from Jupiter. I'm a native.
Really?
So I
Great.
grew-
The Jupiter
yeah.
Inlet?
Yeah.
My son was a free diver and used to dive the Jupiter Inlet all the time.
Me too, believe it or not.
Yep,
I'd like
believe
to
it.
get back there. I got to lose a couple, but love the Jupiter Inlet. My mom still lives there today and
Nice
get up there
area.
every Sunday as well. And yeah, love fishing as well. So we'll have to get out sometime. We'll have to have you back on the show
Look forward.
as well. Thank you, Dr. George Botelho, InjurySpineInstitute.com. Check him out. Thank you for listening to the How to Stay Healthy show.
Thank you so much.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its host, guests,